Welcome to Sounding Board. This is a weekly program completely produced and directed by club members of the Pharmacist International of Novato. Yes, right here in Novato. We've been doing this for about 20 years now, and we just love it. The mission of the organization is to improve the lives of women and girls, both globally and locally. With the Sounding Board program, we have the luxury of inviting just really wonderful people, especially from our community. And today I invited a friend of mine. Jim Crumpler is his name, and he recently retired as a pharmacist from CVS, the one on Grant Avenue, right?
Grant, right.
And I thought, what a perfect time for him to come in after he's recently retired, no ties to anybody anymore with the pharmacy anyhow, and could speak about just medications and how we should live with our medications and how we can take care of our medications. So, Jim, you're a special person in my life, and I'm really happy to have you here. Thank you for being here. So why don't you set the stage for our conversation? What are some key points, Jim, that you'd like for the people to think about their local pharmacist?
Probably, I'm thinking a lot of people don't realize the great resource they have in their local pharmacist. The pharmacist is always there. There's a lot of 24-hour stores that they really are always there. You know, you call your doctor's office, you can never talk to your doctor. Sometimes you talk to a nurse, who knows how much they know. But the pharmacist is always there. And, you know, really, a pharmacist knows more about more drugs than doctors do. So, you know, if you have questions for your pharmacist, they usually have an answer for it. They don't really, it's not that they know so much, it's they have ready access to almost any question that you get asked about drugs.
I know a lot of times when people go in to see their doctor, they're almost overwhelmed with all the information. You know, the doctor has X number of minutes to get through this procedure, and they spell it out so quickly, and it's all new generally. They walk out, and then they forget what the doctor said, and then they're not too sure what they're supposed to do, how they're supposed to take it, what kind of precautions they have. And you know, the law says that when you pick up a new prescription from your pharmacist, the pharmacist has to come out there and tell you. Normally, this is a pretty brief encounter, unless it's a really important drug. And so you go home, you're not too sure what the pharmacist said, you can call him back. You know, you just have to remember that the pharmacist is a real busy guy. And if you call him right at 5 o'clock or right at 1 o'clock in the afternoon, those are his busiest times. And he's not going to give you all of his attention like he should. But if you call him like 7 or 8 o'clock at night, he'll be more than happy to answer all your questions. Really?
Yeah.
And you can call directly, just write in.
Sure, you can always do that.
Interesting. Well, let's go back and talk about some of those medication laws. You had talked about the color of pills at one time with me.
So there's actually a fairly recent law that's really good. I think it's really good. If you look on your vial that you get from the pharmacy, somewhere on that vial...
That's a little bottle you talk about,
That's a little vial that you bring home. Somewhere on that vial, it's going to explain exactly what the tablet or capsule looks like inside. Color, shape, sometimes they'll have numbers on it. So, you know, if a lot of times drugs change. You know, there's generic drugs, and generic drugs are made by different manufacturers, and pharmacies always try to get the best deal for their customers, so they're always changing generics. Well, they usually look different. Like one manufacturer will make them to look one way. So you may have the same prescription, but it may be filled different with a different generic drug, which is going to look different. So if you get home and you look at your vial and the drug looks totally different, you can first check that by reading on the side of the vial and see if that's the description that matches what's in there. And of course, you can always call your pharmacist and say, you know, this looks different than what I got last time. Are you sure that I got what I'm supposed to get?
So in other words, if it's pink rather than blue, don't freak out. Just call your
Don't
pharmacist.
freak out. See what it says on the side of your
Good.
vial. If you're still not too sure, give the pharmacist a call.
Well, before we get too too deeply into the subject of medicines and things like that, give us your personal, real, genuine feelings about herbal medicines.
So there's a few misconceptions about herbal medicines. One is they're totally safe. Herbal medicines are the way all drugs started out to begin with. They're just more refined, but they're certainly potent. You know, like foxglove, that little the digitalis that grows in your garden is a very potent cardiac drug. You know, it could stop your heart.
Wow.
So
Is that an herbal medicine, foxglove? Is it been made into it?
no, but it's an example of an herb.
Oh, okay.
You know.
I see what you're saying.
So a lot of drugs are not harmful. A lot of drugs maybe not harmful by themselves, but if you take them with some of the prescription drugs you're taking, there could be a problem. Also, some of them are expensive. A lot of them aren't proven to work. Some are. So really, I mean, you shouldn't look at on the internet. You shouldn't listen to your neighbor. If you think that it might be a good idea for you to take some of these herbal products, you should probably just ask your doctor, ask your pharmacist, and they will know if they might work, if they might not work, or if they might be harmful with what you're taking.
So a pharmacist could be somebody to go to ask a little
Sure.
advice on even an herbal medicine?
Sure.
Interesting. While we're kind of in the somewhat related area, what about homeopathic medicines?
So I'm glad you asked that. So there's, you know, homeopathic it's a totally different type of drug. It's a wholly different idea of thinking than herbal medication. A lot of times, and it's very confusing because they're right on the shelf together. You can't really, it's hard to tell by looking at them if it's herbal or homeopathic. But like I said, herbal is really a potent medication. Sometimes they work, sometimes they don't work. They could have some problems. Homeopathic, on the other hand, is a totally different way of thinking. Homeopathic people believe that if something causes something, then a teeny tiny bit of that will make that condition go away. An example would be Ipecac you give your child to throw up after he swallowed aspirin or something that he shouldn't have eaten, some sort of poison. So if you give him a tablespoonful of Ipecac, in about 10 minutes the kid will throw up. Homeopathic people would think that if you had nausea or if you were throwing up, you would take a small amount of Ipecac and that would cure it. Well, that basic theory is pretty good. The problem that I have is the dilution factor. So the homeopathic people would say the dose of Ipecac would be you take a teaspoonful of Ipecac and you throw it in a swimming pool and you stir it around and you take a teaspoonful out of that swimming pool and you put that teaspoonful in another swimming pool and you stir that around and then you take a teaspoonful of that and that'll make your nausea go away.
Is it really true or are you just exaggerating with
That's
the swimming pool?
exactly the way
Really?
they believe.
Really?
And so the good thing about homeopathic is there's nothing in there to hurt you. But you could get the placebo effect, which is if somebody tells you something will work, about 20% of the time it probably does.
Right.
So homeopathic is not going to hurt you, and it might actually help.
Interesting.
It could hurt in that you wouldn't be using a real medication to cure your problem, but homeopathic is totally different than herbal. And if you look on those containers, somewhere on it, it's going to say homeopathic. So,
well, let's get back to regular, what you would call regular medicines that are prescription medicines. I guess that would be the best thing to call them. What would a person do to get the very best results from medications?
well, you want to make sure you take it like it's supposed to be taken. Some medications work better on an empty stomach. Some medications work better on a full stomach, and that's just the way they dissolve in your stomach. That's the way they are. You know, and different medications work during different times of the day. So you want to make sure and take it like it's properly taken. Now, probably the doctor will tell you how to take this medication, and you'll probably forget unless your spouse is there to write it down when the doctor's talking about it. And again, when you pick up this new medication from your pharmacist, the law says the pharmacist is going to come out and tell you how to take it, but again, you're probably going to forget. When you get home and you get ready to take it, there's normally a sticker on the side of the bottle that's going to say.
That unrolls and it's about 2 feet long.
Well, yeah, somewhere on there it's probably going to say before meals, after meals, in the morning, in the evening, whatever. But if you're still not sure, you can call your pharmacist, you know, and he will tell you exactly when you should take it.
And so if it says take 3 times a day, I've always been curious about that. Do you just pick any time 3 times a day, or do you sort of sort? Okay, what if you forget and you can take them all at the same time?
So 3 times a day basically means that the drug's going to work about 8 hours. So you want to make those things about 8 hours apart. Now, if it's 6 or 7 hours, that's fine. You basically want to get 3 doses in a day. So what I usually tell people to do is first thing in the morning, take it last thing at night, and try to take it about in the middle.
Okay. So you talked once before about being honest about what the medication's doing to you. Is that to your pharmacist or to your doctor?
Well, sometimes to yourself even. You have to, you know, so the doctor gives you a new medication to take care of a problem. And so you've taken the medication now for a week, and you're not too sure if it's really helped your problem. I mean, maybe your problem seems a little bit better, but maybe not that much. But now something else bothers you that didn't bother you before you started taking that medication. Well, you probably need to talk, you know, be reasonable to yourself and say, I don't think this is working. And what's this other side effect that I've got? So you might want to call up your pharmacist or doctor. Pharmacist is easier to talk to, and just mention, you know, I don't think this is working. Does this always work? And now I think maybe I have a headache when I take this medication. Is that common? And the pharmacist will be able to tell you.
That's interesting because something happened to me not too long ago, and it was on the weekend. So I was trying to get a hold of the doctor. Didn't even think about calling the pharmacist. You, my friend, I could have called you, huh?
Anytime.
Interesting.
They're always there.
Interesting.
Yeah.
I would like to know something. I'm always a little self-conscious when I go in to see my doctor, because if I've got something wrong or some little weird thing, I end up going on the internet, and I do all this research on the internet, and I think, should I share what I know about my symptoms that sort of seem related to that internet, or does that sound like I'm a know-it-all, or does the doctor not even want to hear about all this new internet knowledge now? I mean, how should a person handle that?
Well, you know, the internet has got everything. A lot of bad, some good. You just have to go to, you know, a good website. You know, like there's a website called WebMD, which is real good. It's got some real good information in it. But I mean, otherwise it's like listening to your neighbor talk. I mean, you don't know where his information is coming from. And, you know, I mean, if you've read a bunch of things about something and you think that might be the case, then you can, you know, run it by your doctor, run it by your pharmacist, and see what they think.
It's okay to do that? I mean,
they're usually pretty honest. Yeah. I mean, that's one thing about pharmacists. They want to help you. They're not trying to sell anything, and they're really, really honest people. And, you know, and that's part of our deal, is helping people out. We like it, so.
Yeah. How much, by the way, I don't think we talked about this, but being a pharmacist, how much in education is that involved? Is that a doctorate or what? So
basically a pharmacist got a degree called a Doctor of Pharmacy degree, but it's not a doctorate. It's like a master's. It's equal to a master's.
Okay.
And it's basically the same as a Doctor of Dentistry. You know, he's got like a master's degree. So
what are good skills to have to become a good pharmacist? Do you have memory skills, or
you just have to memorize things?
Knowing all those Latin words?
you have to memorize things. That's not so bad, but you have to be good with people. You know, because you're going to meet, I always used to say this when somebody new would come to my pharmacy and start working. I said, the people that you're dealing with here aren't normal people. Either they don't feel good, or somebody that is important to them doesn't feel good, and they're nervous about it. And so you have to be compassionate. You have to say, this person is having a tough time. Either he doesn't feel good, or his wife doesn't feel good. Something like that. And I think that's part of a pharmacist's job, is being compassionate and taking some time to help people out when they're really concerned.
And I know I'm getting off track here, but we didn't even talk about these things, but I noticed over on Mare Island there's a pharmacy school. Did I see?
There's, when I went to pharmacy school, 40-some years ago, there were 3 pharmacy schools in California. That was it. And for years, there was only 3 pharmacy schools. Then a lot of people got the idea that there was a pharmacist shortage. So then these other pharmacy schools started popping up. Now I think there's 7 or 8 pharmacy schools, which means I think the pharmacy shortage is just about over.
Okay. Well, let's get back to medications. One thing that I have always been curious about are those expiration dates. Are they really real? I mean, I look at those things and it says expires, and then when it comes time for me, I think, I could use that same pill that I had last year, about this time, and then it says it's expired. Can I really use that?
So another thing that I'm really glad you brought up. Everybody's confused about expiration dates. So when it comes to almost all tablets and capsules, they're good for a long time.
A long time?
A very long time.
Well, is that like 10 years, 20 years?
Maybe longer, depending.
Really?
You don't want to store them in the worst place in the house, which is the humid bathroom.
Yeah.
But if you put them someplace, where they don't have a lot of temperature change, they could be good for a long time. What does happen to them is maybe after a long time, they may lose some of their potency. They never go bad and will hurt you. It's, medication is not like cottage cheese. It doesn't really go bad, and it doesn't turn into something that's going to hurt you.
Interesting.
Now, that's not 100% true. There are some tablets and capsules that are only good for a short period of time, but 99% of them, they're good for a very long time, and they're not going to hurt you.
Would the pharmacist be honest and say,
of course,
they would tell you?
Now, when we're talking about medications, eye medications have an expiration date because something can happen to that liquid.
Like eye drops or
like
something.
Eye drops, and the big thing is children's liquid antibiotics. Those are only good for about 10 days, 2 weeks. Sometimes 30 days, but those you have to be careful with. But just normal tablets and capsules, 99% of them are good for years and years and years.
Let's talk about the issue of disposing unwanted medication. I've heard all kinds of things.
Oh,
what are you
my
supposed
God.
to do?
This changes every 10 years. This changes.
Yeah.
When I for the first 20 years I was a pharmacist, flush them down the toilet. It's safe. Nobody's going to get to them. You don't want to put them in your garbage can because who knows who's going to get in your garbage can, and you don't want kids getting in your garbage can and take them. Well, about 5 to 10 years ago, all that changed.
Yeah.
Now we're polluting the environment unless we properly dispose of it. So actually with CVS, for a few years, we would take them back. Then whoever was taking them from CVS and disposing them started charging CVS a lot of money to do that. So now CVS doesn't do that anymore.
Wow.
So I think Kaiser does. I think some hospitals do. I think the fire department does. But
Mary's back there smiling. She's one of our camera people. She's a nurse. She knows.
But you can't dispose of them yourself.
You can't. Interesting. So possibly asking a doctor where you got them, maybe they would have them. So what's going on that's new at the local pharmacy?
So like everywhere else, the tech generation is coming along with the pharmacy, and so now, at least with CVS, whatever happens with CVS happens with all the other chains. Now you can come in and give them your cell phone number, And when your prescription is ready, you will get a text message that
Yeah,
says it's ready.
that's good. I really
Now,
like that.
of course, when you call in for a refill, that's nice to have a text message, but that also works when you drop off a new prescription. You'll get a text message when you're walking around the store when your prescription is ready.
Really?
So that's a good
Interesting.
deal.
Interesting.
And then, let's see, what else is new? Of course, now, as of the last few years, pharmacists, for the first time ever, are actually giving injections.
Whoa, really?
You can get, you can get overseas vaccinations. Of course, you can get your flu shot.
Yeah, flu shots.
And all that. You can get those down at your local pharmacy. Almost any pharmacy can do that.
Really?
And the reason is somebody, and they're right, the vaccinations are really important.
Mm-hmm.
And they need to make it easier to get vaccinations.
Mm-hmm.
So
Interesting.
that's what we're doing. You can get a vaccination in any pharmacy.
I've noticed when I've traveled internationally, pharmacists always are giving shots. I've noticed that for years, and I've always been curious why our pharmacists haven't been able to do that.
Exactly.
Yeah, interesting.
Also, the brand new thing coming out is when you get a new disease state. So let's say you go into your doctor's office and the doctor says you're borderline diabetic.
Mm-hmm.
Well, that means a lot of stuff. He might tell you stuff. He might have his nurse come in and tell you stuff. But the new thing is that you're going to be able to go to the pharmacy. The pharmacist is going to say, oh, I need to talk about your new condition. We'll walk around the corner here. He'll sit down with you and talk to you one-on-one for like 5 or 10 minutes about your new conditions, what you need to look out for, or the cautions you need to take. And the reason he's doing that is because the insurance company will actually pay him to do that.
Really?
So,
Interesting.
It's a good thing for people. It's a bad I'm not too sure how pharmacists are going to find out how to fit out another 10 minutes in their day to do that. But basically, it's a good thing.
Good. And you mentioned also something before when we talked that the pharmacy is going to be sort of like red flagged or something like that if they're not following their prescription adequately. You said something about that the technology is going to eventually be able to go back, trigger the doctor.
Oh, that's true. Well, what happens is every prescription you do just goes on a big computer. Mm-hmm. And of course, 90% of all prescriptions goes on not only your computer, but your insurance computer. Well, the insurance computer checks all this stuff, and if there's a problem, like 2 conflicting medications that you shouldn't be taking, they might contact you. Mm-hmm. They might contact the pharmacist and expect the pharmacist to contact you. They might contact the doctor. It's a good thing, because a lot of times people go to different pharmacies, they go to different doctors, but they basically always have the same insurance. Mm-hmm. So it's a good thing. It's kind of like a triple check.
Well, now tell me the real serious impact that the mail-away pharmacies have on you guys. I mean, is that going to take away all your business, the mail-away pharmacies? Because there's a big push to do that by the insurance companies.
The insurance companies want you to mail away for your prescriptions because it's a lot cheaper for them. Mm-hmm. And if you do that, they make it a lot cheaper for you. Mm-hmm. The problem is when you have a personal question, sometimes it's hard for you to talk to just a stranger. Mm-hmm. So that's why, over the years, you've had a good repertoire with your pharmacist. You can go in and talk to them about all kinds of embarrassing things.
You've probably heard it all.
Now you're going to be mailing away. You're probably going to feel funny going back in and talking to the pharmacist. The way I feel is, I'm here to help people. I don't care if you get your prescriptions here or not. Mm-hmm. But it's unfortunate in that if you get a new prescription from me, I have to go out and personally talk to you. Mm-hmm. If you get a mail away, they just send you some reading material. Now, when you come to me, I also give you reading material, but I go out and talk to you personally. Mm-hmm. The mail-away pharmacy doesn't have to do that. And I've had to call mail-away pharmacies to get questions about a prescription that people would bring to me. They want to transfer, and it takes forever to get to talk to anybody on that 800 number. Wow. I mean, it's very difficult. So, I mean, that's just the way things are. You have to do it. It's so much cheaper for you to do it. If you have a question, you can still call you can call the pharmacy. The pharmacist doesn't know who you are. He doesn't know if you got your prescription in there or not.
Yeah. Well, you know, you certainly seem like you've enjoyed your job, Jim.
Yeah, I really have.
Yeah. Does it really feel it's a satisfying job to be a pharmacist?
Yeah, I mean, you know, you get to help people. You know, somebody. Well, two examples would be somebody comes into me on a Saturday, and they've got a punctured or a burst artery in their eye, and their eye looks horrible. It's all red, and they're like freaked out when they go, "Oh my God, look at my eye!" And I say, "Don't worry about it. It's no problem. It's going to go away. You just got a broken blood vessel in your eye. It'll self-absorb all that blood. Don't worry about it." On the other hand, they'll come in and they'll say, "You know, I've got this swollen finger. It's kind of infected. It's a little bit red. What can you give me for it?"
Yeah.
You know, and I take one look at it and I say, "I have some bad news. You're going to have to go to the emergency room and get that taken care of. The infection is inside your finger. There's nothing you can put on the outside that's going to cure it. It's only going to get worse. The sooner you go to the emergency room, the better." So, you know, in that, you know, I've helped out two people. You know, one person was all freaked out. They wanted to go to the emergency room. Nope, you don't have to go. The other person thinks, "Oh, I can cure this on my own." Nope, you can't cure that on your own.
So if we were to wrap this up, Jim, I know you had a lot of points that you wanted to tell people, especially about hours and approachability of pharmacists. So I wanted you to just sort of give us some really good pointers and bullets to remember.
The big deal now is all pharmacists are the same. There's just fewer of them. You know, all these big companies, they looked at the pharmacy and they see there's a lot of profit to be made here, but we have to get rid of that pharmacist. He makes 4 times more than anybody else in that pharmacy.
Yeah.
What can we do to get rid of it? Well, let's put a robot in there that fills all the prescriptions. Let's change the law so he doesn't do the actual counting and filling of the prescription. All he has to do is check it. So over the years, they've done all these things. When I first started working at my store, we filled less prescriptions than we do now, and we had 4 pharmacists.
Wow.
Now we're doing way more prescriptions than we did back then, and most of the time there's only one pharmacist to do all of that. They have to check every prescription that comes through there. They have to give flu shots. They have to counsel every new prescription that comes through there. Half of your prescriptions are new prescriptions, so you know, if you're doing 500 prescriptions a day, there's 200 of them you're going to have to walk out and talk to somebody about.
Good.
So yes, you can talk to this pharmacist, but call him on the phone.
Call him on the phone.
At 8 o'clock at night.
At 8 o'clock at night. Good, good. Well, thank you, Jim. It's just a fabulous wealth of information that you were able to give us in just a short amount of time. Just fabulous. And I hope we can take advantage of more retired people in the community with some good ideas and things like that. Thank you all for being our listening audience. And thank you, Seroptimist Club members, for being the crew behind the scenes. And thank you, Novato Public Access Television, especially Rick and Leon, who are always fabulous there for us. Thank you.